Doctors and government leaders are urging us to get tested for COVID-19, even if we don't have symptoms, with dozens of businesses, hospitals, and pharmacies offering different types of tests for varying prices. It's tough to decide where exactly to go.
It is. This morning, our consumer expert, Amy Davis, she went to one of the physicians on the front lines to get some answers. Amy?
Hey, guys, we did. Dr. Joseph Verone is the chief of staff at United Memorial Medical Center in Houston, and his hospital has administered more than 210,000 COVID-19 tests, which puts him in a unique position to study the reliability of the different types of tests available. Cars line up for drive-through testing outside UMMC on West Tidwell near Shepherd in North Houston. These days, you can get in and out in less than 20 minutes.
Someone in our office, their family members tested positive, so they're out. So I said, I better go get tested.
You can't beat the convenience, but Dr. Joseph Verone says this line should be longer.
There is no question that everyone should be tested. Everyone.
That's because he says 48% of people who have tested positive here had absolutely no symptoms.
And yes, they may have no problem, but the problem is that they are surrounded by other persons and they are spreading it. They are what we call the super spreaders.
If you knew you had COVID-19, Verone said you would probably quarantine, wear a mask, and be more careful not to expose others. But where do you go for a test, and what kind should you get?
The most reliable tests are the ones where you put in a little swab inside the nose and you look for either particles of the virus or evidence that the virus has been there.
What he's describing is a PCR test, the gold standard when it comes to coronavirus testing. It's a nasal swab. Results for this test take at least 24 hours, and it's the only test the government mandates must be free. If you pay for a rapid test, even if it's a nasal swab at a local clinic, pharmacy, even a hospital, the test is not the same. You can be charged $150 or more, and you have a 20% chance of having the virus, even when the results of these rapid tests show you're negative.
If it's positive, great, at least you have an answer right away. But if it's negative, you are not 100% sure that you're negative.
And Verone says saliva tests and mouth swabs are even less reliable, with about a 30% chance of giving you a false negative reading.
And the reason why is because the virus likes to live in the back of your nose.
Some of you have emailed that you went to a doctor for a PCR test that should have been free, but you were charged. Verone says that could be because you were given other tests in addition to the COVID test. And if you had symptoms, that's reasonable. He says doctors are trying to determine exactly what's causing the symptoms. To avoid surprises, Verone says you should ask in advance.
You should ask them. You should ask, hey, am I going to be charged for anything? Am I only being tested for COVID, or are you going to test me for other things?
Lastly, the most unreliable test is the antibodies test that requires blood from a finger prick. Verone says it is inaccurate 50% of the time.
The antibody test right now is not something that should be used routinely for testing.
Okay, so how often should you be tested? Verone says if you have no symptoms and no known exposure to anyone who's tested positive, you should get tested once a month. But he says you shouldn't have to pay for it.